breast cancer diagnosis can be overwhelming for you, but understanding the treatment options will make your journey smoother and will also empower you. The treatment of breast cancer has 4 main parts: surgical, which is the operation; chemotherapy, wherein we give saline and certain drugs in the saline; radiotherapy, where we give some x-rays; and hormonal treatment, where we give some tablets to you. Today, I am going to talk to you about surgical treatment of breast cancer. Surgical treatment of breast cancer or the operation, the first and the foremost thing that you need to understand is the surgery is relatively simple, recovery is very quick, and most people can undergo this surgery. Even if you have health conditions like diabetes, hypertension, or you are slightly on the higher side of the age spectrum, say you are 70 years old, you can undergo this procedure safely. 99% of our patients get discharged on the next day. When they get discharged, they are able to move about on their own, take a shower, or even prepare a cup of tea for themselves. So you can understand that most people will be able to take this surgery very well in their stride. When it comes to the details of the surgery may be divided into 2 parts. See, breast cancer starts in the breast and has a tendency to go to some glands in your armpit. So the surgery also has 2 components, one in the breast and the other in the armpit. In the breast, the surgical options may be divided into 2 parts. One, complete removal of the breast, what we call as mastectomy, and second, removal of only the tumor part of the breast, what we call as lumpectomy or breast conservation surgery. Now, most patients have a fear that if I have breast cancer, I will end up losing my breast. That is not so. The choice between mastectomy, which is complete removal of the breast, and breast conservation surgery, which is only the tumor portion removal, depends on many factors like the number of tumors, the size of the tumor, the location of the tumor, and is best decided by consulting with your doctor and yourself. But even if you have to undergo mastectomy, which is complete removal of the breast, we can reconstruct the breast in the same setting by saving your breast skin and nipple, removing the breast from inside and reconstructing it by means of implant or your own body tissues. If we are doing a partial removal, which is removal of only the tumor portion of the breast, we have techniques which we call as oncoplastic breast surgery techniques. These are a combination of surgical techniques and plastic surgery techniques wherein we can prevent ugly deformity of the breast. So the fear that you will end up losing your breast or have an ugly deformity of the breast is unfounded. As far as the surgery of the armpits is concerned, there are certain glands in your armpit and the breast cancer has a tendency to go there. Previously, we had to remove all these glands, but now we have techniques known as sentinel lymph node biopsy, wherein we inject certain dyes and we can remove only 2 to 3 lymph nodes, particularly if you have early breast cancer. By doing so, we prevent long-term complications like swelling of the arm, which can be really troublesome in some of the patients. So what I want to tell you is, in comparison with some other cancer surgeries, breast cancer surgery is very well tolerated. Most patients will go home the next day, and by day 5, you can do simple things like taking a walk in the park or preparing a small meal for your loved ones. And there is no need to be afraid of this surgery.